Good afternoon, everybody. So, today's class is Preventive Pediatrics. So, we all know that pediatrics means it's a branch of medicine which deals with children, like what our social and preventive medicine, community medicine people are dealing with it. Definitely, we do have a role. Both the obstetrics and pediatrics are closely connected with preventive and social medicine. So we'll be talking about the preventive pediatrics in the coming two class sessions. So preventive pediatrics is the branch of the medical science that deals with the care of children from conception to adolescence in health and disease, both disease as well as health. Actually, pediatrics means they will be curing the disease, but we will be also dealing with the maintenance of health, prevention of disease. Okay, so and also another terminology to be remembering here is it is conception to adolescence. Okay, so it's not like after being born only that the fetus is being taken care of, but from conception, by the time the baby is conceived in the mother's womb till the child reaches the adolescence, all the care. So all the things that which deals with this age group will be coming under this preventive pediatrics. Okay, so aim is preventive pediatrics is same of that of community medicine, that is prevention of disease and promotion of physical, mental and social well-being of health, that is of children, so that each child may reach the genetic potential which with he or she is born. Like she must be able to achieve he or she must be able to reach the highest level of health. Okay, so that is the aim of this preventive pediatrics. So in this preventive pediatrics, the strategy of primary healthcare is adopted to improve the to improve this child healthcare services. So you all know that the primary healthcare is like a universally acceptable mode of healthcare where it is scientifically sound and it must be socially acceptable. Okay, we all know the principles of primary healthcare, the community participation and everything. So this component, this strategy is being implemented in this preventive pediatrics. Okay. So we also know that this primary healthcare has a increased coverage. So it has a very vast coverage and it has an integrated system of service delivery. We have different systems of service delivery at primary level, at secondary level, at tertiary level. So all the systems would be integrated, and then the vast coverage is achieved through this primary healthcare. So this is being utilized with the preventive pediatrics. So this is the best solution to reach millions of children, especially those who are vulnerable. So those who are who are in need of this preventive and curative services. So primary healthcare approach is utilized here in preventive pediatrics. So the efforts in preventive pediatrics is mainly to avert rather than cure disease and disabilities. So avert means it's nothing but prevent, to ward off. So to prevent the disease rather than curing the disease. Okay. So under the preventive pediatrics, there are so many activities which are given, like growth monitoring of children, oral rehydration to treat diarrheal diseases, nutritional surveillance, which we have talked already before in the previous classes, promotion of breastfeeding, which is a very, very important activity, immunization for prevention of common diseases, community feeding, and regular health checkups. So these are so many activities under this preventive pediatrics. But here we will be classifying this preventive pediatrics, and we will talk about this in a systemic way, and also what are the activities and all that in this preventive pediatrics. So this preventive pediatrics is again classified into three kinds. First one is antenatal preventive pediatrics. Next is postnatal preventive pediatrics. And another one is social preventive pediatrics. So by this terminology itself, you can understand antenatal preventive pediatrics means antenatal means before the birth of the child. That is while the mother is pregnant itself. So like I told you in the definition of preventive pediatrics itself, we are taking care of health of the child from conception till adolescence. So from conception till the child is being born, all the care of the child is dealt in the antenatal preventive pediatrics. And postnatal preventive pediatrics is after the child is born till the child reaches the adolescent age. Because after crossing the age, the child would be no more a child but an adult. And social preventive pediatrics. This is a little new branch. Like we'll be talking about this in the next slides. So today in this session, we will talk about antenatal preventive pediatrics and half of the postnatal preventive pediatrics. Okay, remaining we'll talk in the next session. So coming to the antenatal preventive pediatrics, previously antenatal care, like whatever the NCH services are there, it is mainly to prevent the maternal mortality. Yes, right. So only to prevent the maternal deaths. But because of the improved NCH care services, so much efforts are being put by the government to tackle the maternal deaths. So slowly the maternal mortality ratio has us coming down, like year by year there is the maternal mortality ratio is coming down, and it is like okay, we can tackle with it. So now the attention now is shifted to the child, that is the child within the mother, the pregnant mother. So first thing is to decrease the perinatal mortality. So the mother would be carrying the child for 9 months till the womb. If a dead baby is born, if there is no use, like it brings lot of griefness to the family. So so now they have shifted the attention to the decrease the perinatal mortality, and also secondly to prevention of perinatal morbidity. Perinatal means the period around the childbirth, that is in and around the childbirth, like first 7 days and during the time of delivery, all this period would be coming under perinatal period. Yes. So and even the perinatal morbidity. Morbidity means certain diseases like illness or disease or whatever. So at the time of the delivery, like we can see so many conditions which affect the child's health. So in turn, it may be causing the death of the child, or it may cause lifelong disability or illness like that. So and now recently the shift has been changed to the fetus at risk. So we know that certain children are at risk based on the health conditions of the mother, based on the previous obstetric history and everything. We can identify which child is at risk, okay, or whatever the healthy pregnancy. So whatever complicated pregnancies and healthy pregnancies we can differentiate, and those risk pregnancies must be given greater attention. Yes. So antenatal care should appropriately begin even before the mother conceives. So actually antenatal care means we usually think that after the mother when she misses her period, she will be visiting the gynecologist, and she will be starting the antenatal care from then. She will be taking the folic acid, calcium tablets, and again second trimester she'll be taking the iron tablets, and whatever supplements, food supplementation will be increased and everything. That will be started after she becomes pregnant. But actually the appropriate method is the antenatal care should begin even before her conceivement, that is at the reproductive age. So that is why when we see the different RMNCH plus A programs, RBSK programs, that is even the adolescent girls are given priority, because that is the age group when you have to begin the nutritional supplements. We have to prevent the iron deficiency anemia. Okay, and you have to make the girl physically strong so that she can be fit for giving birth to child. So before entering the maternity cycle itself, the women should be taken care of. Okay, so there are so many recent developments, like even before the child is born itself, even in the early weeks of pregnancy itself, we can diagnose certain congenital anomalies and inborn errors of metabolism. So many biochemical tests and the development of this radiological advances, we can identify so many congenital abnormalities and other inborn errors. So that in that way we can even prevent the birth of like disabled children, or certain like anencephaly or certain diseases, they will be dead immediately after birth. So there is no use of continuing the pregnancy. So in that way, so much of pain, this morbidity, mortality can be prevented priorly itself. Okay, so this technical developments have contributed a lot to this. So antenatal preventive pediatrics, like so many MCH care services we know, like the antenatal checkups, like how many antenatal checkups the mother has to go through, and what are the supplements she has to take, what preventive measures she has to take to have a healthy pregnancy, to deliver a healthy baby. So all this also would be coming under this antenatal preventive pediatrics. So under these measures, we will be talking about certain activities like genetic counseling for prospective parents. We know that genetic counseling is of two kinds, prospective and retrospective. So prospective is those parents who are having any genetic problems like beta thalassemia or certain sickle cell anemia. They can be counseled even prior to marriage itself, like what at risk, if they have, what risk they can transfer to their children. So the couples can go through this genetic counseling to just check through whether how much risk they can bear to their children if they are having any genetic diseases known. Okay, and another one is retrospective genetic counseling. This is very common because this usually happens when already the genetic abnormality has taken place in the family. But suppose the first child is born with anencephaly, or it is diagnosed priorly, what is the risk of getting the anencephaly again in the next pregnancy, or first child is born with Down syndrome, what is the risk? Like that way we can get the genetic counseling to prevent this morbidity in children. Okay, so genetic counseling plays a very important role in that. If the parents are having any genetic diseases, or if any genetically abnormal child is born in the family. And next, another measure is limitation and proper spacing of births. Definitely, there should be a spacing of births at least for period of 2 to 3 years. If the interval is very less, the chances of low birth weight babies, again the perinatal, the infant mortality, neonatal mortality, they may uh, they may rise up. Okay, so spacing of births and family planning is very important to limit the number of children in the family, and even spacing is also very, very important between births. And another measure is delaying a young woman's first pregnancy until she is physically fit and socially mature. So every girl cannot be a mother like immediately after marriage. Like she cannot become a mother, like because mother requires so much of. She must be very mature enough to handle things, like just having physically a human body, having a uterus to deliver a child is not sufficient. She must be financially stable. She must be socially mature. She must be able to. She also must be physically fit. Her health should be cooperating to give birth to a child. So it is always better to delay the first pregnancy until all this all these measures are she can able to handle, the women especially. So husband role is different, the wife role is different. So that is why in teenage pregnancies, like early marriages, so this is the very problem. Like they cannot bring up the children, like they cannot, they are itself, they must be mature enough to handle the children. Okay. And ensuring adequate maternal nutrition, yes, definitely mother's nutritional requirement is definitely increased during pregnancy. She has to take more than food which she is actually taking. So the increased calories, proteins, she must be taking enough to deliver a healthy baby. Yes. And next, protection of the unborn against intrauterine infections and other adverse influences. Yes, we know that there are so many infections which can be transferred congenitally through the mother. We know that the starch infections, syphilis, all this, uh, herpes infections, and all this. Yes, rubella and all. So this can be transferred to the mother, the tetanus and all. So she must be protected. She must be taken care before to prevent any intrauterine infections. Okay. And MCH care, we have so many MCH care related activities given, undertaken by the government, but we also have the risk approach. What is meant by risk approach? Risk approach means all the pregnant mothers are like their high risk groups. Yes, definitely a pregnant mother means it is a high risk group, but still some category of pregnant mothers are much more at high risk. Yes, like elderly gravida, those with more than 3 number of children, those are having iron deficiency anemia, those are having hypertension, diabetes, those are having more than 3 miscarriages. So all this, there are certain category of pregnant women who are much more at risk. So along with delivering the routine MCH care services to all the pregnant women, the women who are at risk, they have to be given a much more focused attention compared to the regular pregnant women group. So that is the risk approach. It is not that the pregnant women must be only these people must be given care, but all the pregnant women must be given enough care. But those who are high risk groups, they have to be given much more focused attention. Okay, they require much more frequent antenatal checkups. They require much more supplementation, like guidance from the doctors, the treating physicians, and everybody. Okay. The next one is birth preparedness and complication readiness. So this is a little new term for you. I will talk about this in, in detail in the next slide. And another one is mothercraft training. So as I already told you, like every woman cannot be, like she is not ready to be a mother. Like there has to be like in home means like the elder, like her mother or mother-in-law, like whoever elders present in the house, they have to counsel like the pregnant women, like what health related measures she has to take and how she has to handle the baby. So this mothercraft training is directly given by the professionals like ANNs or ASHAs. They have much more better knowledge compared to the women in the family, right? So they will be taking classes for the pregnant mothers, like how to handle children, how to take care of the pregnant mother, how to take care of her after birth, like everything, like even the budget management also, like economically, how she can how she can save money, home economics, like how to manage house, because she's not she cannot do all her regular household works. So everything will be taught to them by ANMs, ASHAs, like that. So that is mothercraft training. Okay. So we'll talk about the birth preparedness and complication readiness. So birth preparedness and complication readiness is nothing but it is also like an antenatal counseling strategy where the mother will be, the antenatal mother who is going to be deliver, they will be counseled by this ANMs and ASHAs and healthcare workers in that particular area. So they will be encouraging them to take decisions before onset of labor and potential occurrence of obstetric complications. So it is nothing but before giving birth itself, that is the mother, while she is pregnant only, she must be ready enough to handle the things like pregnancy itself. It's a, like a what do you say, it's a complicated course, like she has to undergo so much of pain, like she it requires so much of attention. So she has to decide before itself where she wants to deliver. She wants to deliver in a government hospital or a private hospital, or the doctor who has to do the delivery for her. So everything she has to be prepared priorly, because at when she's at home, suddenly labor pains occur. She cannot decide like where to go suddenly. Uh, she cannot like decide like whatever near close by to her house where she can go freely. That has to be decided priorly. So this is everything will be counseled before but before the labor itself. Okay, and also she will be informed about the signs of complications. So if there is any bleeding per vaginum, there is any leakage of water, that is amniotic fluid, um, and there is any blurring of vision or severe headache. So these are the any convulsions. She has to identify that that complication. So she has to report immediately to the doctor. She cannot delay that. So the all the complications must be informed to her priorly, and also inform them location of emergency services to improve care seeking process. So in case of any emergency, like something has happened, something she fell down or something has happened, there is some sudden bleeding in her seventh month, like she has to know where the emergency services were 24 by 7 will be available, like at night time or whatever, nearby first referral unit, FRU, or whatever, something she must be known, so that she can inform somebody to take her there. Okay, and encourages them to save money. Yes, definitely, because financially it's very very important. You all know that. Do you know the 3 Ds of maternal mortality? So 3 Ds means 3 delays. So most of the causes of this maternal mortality is due to this 3 delays. First delay is delay in taking decision when any emergency occurs, and second one is delay in seeking treatment, like delay in reaching the obstetric facility, and third one is delay in getting treatment after reaching the obstetric facility. I think I'm clear. So that is, first of all, she has some people, what happens, something at night, something will happen. They will not know, like they'll think like, okay, no problem, we'll go in the morning. So by the time so much of bleed may occur, by the time the mother may land up in shock, or the child may die in itself. So they, all people may not be smart enough to take decisions immediately. So some illiterate people, some like they don't know. So such kind of delays may cause the. This is actually, this 3D model is actually talking in case of maternal mortality. So even like antenatal preventive pediatrics is also about this delays itself, because we are also talking about the child in her. And another one is delay in reaching the obstetric facility. So at something at late night, some 3 o'clock, something had happened. So how she will reach the hospital? Who will be there for her? Like what transportation facilities there? Is there any rickshaw or auto? Like she must be having some person beside her to take care of her. Okay, and another one is delay in taking treatment after reaching the obstetric facility. So she somehow decided to go to the facility. She got an auto or some rickshaw, something. She reached the obstetric facility. But what if there are no medicines there to treat her, or there is no doctor or nurse or somebody to treat her? So that is again another delay. So these are the 3 delays which can cause maternal mortality. So for the first, for the second one, especially for the transportation and for the seeking of services, she has to have some money with her. So as sudden money kavali ante ekkada vastayi, so she has to have some money with her. So they have to save, they will be telling her like how you have to save the money, like what you have to do in case of any emergency. Okay, during any suddenly labor pains occur, so delivery చేయడానికి డబ్బులు లేవంటే ఎలా అవుతుంది? So she has to be known everything. What are the charges, how much is ఎంత అవుతుంది, if it is cesarean how much, if it is normal labor how much. She has to save money for seeking all kind of services in pregnant mother. Okay, so this is about the birth preparedness and complication readiness. And postnatal, so after baby has delivered, so this is all about antenatal. Now after baby is delivered, how can you take care of the child, how can you prevent diseases or deaths in them? So first, under this we have so many measures again here: essential newborn care, kangaroo mother care, promotion of breastfeeding, introduction of complementary feeds at appropriate age, immunization, growth monitoring, periodic health checkups, first level assessment, and care of childhood illness. So today we will be talking till introduction of complementary feeds in this class. So first, essential newborn care. We know that there are so many kinds of newborn care: emergency newborn care, facility-based newborn care, home-based newborn care. So all these are important, but essential newborn care is basic. So it is basic to protect the child, like at the immediate after birth, what you have to do, and for the newborn to make the newborn survive. So what you have to do? So under this, the key components is warmth or warm chain, it is called as. So under the warm chain, we have again so many steps here. So in the warm chain means it is like from the time the baby is born till the baby is discharged or going to, after, of course, definitely after going home also you have to maintain the baby warm. So why you have to maintain the baby warm? Why do you need to make the baby warm? Like, why can't it be cool? So that is the reason is, during the baby during the time the baby is in the mother's womb, it is in protection of amniotic fluid, which is warm. Like in the womb it is warm. When the baby comes out, immediately the temperature is different from the temperature inside the mother's womb. It requires time for the baby to adjust to the outside world temperature. So for that you have to maintain the temperature. So the delivery room in which the baby is being delivered should be warm. It should be more than 25 degrees centigrade. It should not be like AC rooms and all. It's not suitable. Of course, definitely in cesarean we do it in AC rooms, but still after birth you have to immediately warm up the baby. You have to keep the baby warm. So, and next step is warm delivery surface, warm resuscitation. So immediately after the baby is born, it is the nose and everything, mouth is filled with amniotic fluid and all the secretions. You have to resuscitate the baby to enable the breathing. So the resuscitation, sometimes a bag and mask ventilation may be required. So that the process thing should be happening in a warm way, like warm resuscitation. Okay, next thing is immediately the child has to be dried. So it is filled with amniotic fluid, the blood and everything. So it has to be immediately covered. Okay, you have to dry it. Okay, and next is the baby has to be kept in close contact with the mother. You have to give the baby immediately to the mother so that she can put the baby close to the skin. It's called skin to skin contact. So the mother's temperature is transferred to the baby temperature, baby's body. So that way a direct skin to skin contact should be there, and the mother should immediately initiate the breastfeeding as well. Okay, so and next one is the uh, after giving the like breastfeeding, it is always ideal to postpone the bathing. You should not bath the child immediately just because the baby is filled with this blood and everything. Sometimes meconium may happen, but still you should not bath the child immediately. So it is better to postpone the child's bathing for 24 to 48 hours. Okay, and appropriate clothing. You have to cover the baby in clothes like a warm blanket or something from head till toe, except the eyes and nose and mouth, except the face area. The whole body should be immediately covered. And also, it's also better to maintain the rooming in. Like rooming in means the mother and baby should be together. Like, of course, in some unacceptable situations, like the baby should be kept in ICU, that we cannot do. But it's good that if the baby is kept, mother and baby are kept to be, or they have to be kept together. And another one is professional alert. That is here, the temperature must be checked. The doctor, whoever the physician who is treating them, should be constantly monitoring the health and the temperature of the child. And another one is warm transportation. So when till the whole process, like till the child is discharged, the child has to be maintained in warm temperature. So this is the warm chain. So from birth till the child is discharged or till it reaches the home, the baby must be maintained warm to prevent hypothermia, because hypothermia is in again a causation for the infant mortality and morbidity. Okay, and immediate breathing or resuscitations, like already we talked, like it is difficult for the child to immediately start breathing in the outside world, so resuscitation is required. And breastfeeding, yes, we'll talk about this in detail again. And infection prevention, yes, during the time of especially the birth of the child, there are 6 cleans which has been taught to eliminate the neonatal tetanus, especially for a safe delivery. That is clean hands. So whoever is delivering the child, physician, the hands should be clean. And clean delivery surface, wherever the mother is being delivered, the bed or the labor bed, whatever it is, that should be clean. It should be sterilized. And clean cord, clean cord tie. So the cord between the mother and child is the stump, the umbilical stump, that has to be cut, right? And you have to put a umbilical what do you say, clamp. So that should be clean. That should be, you cannot just put some needle or some cloth, you cannot just tie it. You have to use a sterile umbilical clamp. So clean cord tie, and clean blade, like scissor, clean blade or scissor. You'll be cutting the cord between the mother and baby. So that should be clean. And now that is actually 5 cleans of given, but recently another clean is also added, that is clean clothes. The whatever you cannot just put some used cloth or some damp cloth to cover the baby and mother. Like the clothes which you are covering the baby and mother also should be clean. So, and hand washing practices, definitely. So after the child is being born, so it's not ideal to everybody to touch the baby. So they have to wash their hands and touch the baby. And active lookout for danger signs. Yes, there are so many danger signs which the mother or the family, they have to be aware, so that they can take appropriate measures to prevent mortality or morbidity. So some danger signs, like example, any convulsions, baby is not feeding well, not taking the breastfeed, any hyperthermia, high grade temperature or hypothermia, jaundice, cyanosis. So there are so many examples. So all these danger signs must be looked upon. and any fast breathing the child. Okay. So another next measure is the kangaroo mother care. So this is actually kept in place for the low birth weight babies or preterm babies. Here the baby is naked. You will remove all the clothes from the baby except the nappy and head cap, and you will keep in direct contact with the mother's chest. The baby's chest should be touching the mother's chest, and she can be clothed. The mother will be clothed. So by keeping like this, the bond between the mother and baby is increased, and also hypothermia. This is mainly to prevent hypothermia. Okay, so hypothermia is prevented. So next very important measure in the postnatal preventive pediatrics is breastfeeding. Yes, under normal conditions, Indian mothers would be secreting 450 to 600 ml of breast milk per day, and 100 ml of breast milk contains about 1.1 gram of protein, which is ideal for the growth and development of the baby. Okay. So energy value is 70 kilocalories per 100 ml, whereas protein is 1.1 gram. So what are the recommended practices for this breastfeeding? Main thing is early initiation of breastfeeding as early as possible, preferably within 1 hour of birth. Of course, in cesarean section, it's not possible. They say that it is within 4 hours like that, but ideally is early initiation of breastfeeding within 1 hour of birth or as early as possible. Of course, in normal delivery, if the mother would be awake, so she can immediately start off the feeding immediately after the child is born. And the breastfeeding must be continued exclusively till the child reaches 6 months of age. The child must be completing 6 months of age. So except breast milk, nothing should be given. No need of any water, no need of any syrups, no need of any woodward, something gripe water, no need of any some turmeric water or whatever nonsense the grandmothers everything they'll be giving. Nothing should be given except the vitamin supplements or whatever suggested by the doctor. Okay, vitamin D drops are given usually to children. So except that, nothing, no else feed, solid food or liquid food should not be given if the mother's milk is adequate. And complementary feeding should be begin after the child completes 6 months of age along with breastfeeding. It's not that after 6 months you have to stop the breastfeeding. That the child must be given breastfeeding till 2 years of age ideally, or even more than that. So but after 6 months you have to start with the complementary feeds. And it's always good to give the on-demand feeding. So there are two kinds of feeds, on-demand feeding and scheduled feeding. On-demand feeding means if the child, whenever the child feels hungry, whenever the child cries, whenever the child requires, you can know by its actions and everything that the child is requiring breast milk. So immediately you have to give the breast milk. Scheduled means like every 2 hours. It's not, instead of scheduled breastfeeding, it is always good to practice on demand feeding. So if anybody like in Viva or anything, if they ask, on demand feeding is whenever the child asks for, like it will not ask for because they cannot talk, they will not tell mama I want breast milk. No, they will not say like that, but we can, the mother can identify because of its actions, like its cues, like they will the cry will be different. Okay, so by that we can understanding by its mouth gestures and all, we can understand that the baby is hungry or thirsty, whatever. Then the baby should be initiated the breastfeeding. Okay, and lactating mother requires 550 calories extra per day to meet the needs of production of breast milk. Yes, definitely, breast milk to produce, the mother requires much more calorie requirement. So coming to the composition of breast milk, if you see, maximum 88% of it is water, and in the remaining part 3.8% is fat, protein comes under 0.9%, and lactose is again a little higher, 7%, and other factors like antibodies and all, this fatty acids all would be 0.2%. So if you see the breast milk composition, it will be varying in different kinds, because after birth and everything, to suit the needs of the baby, like you can understand like how great the God's creation is. So if you see initial first 3 to 4 days after delivery, you'll be getting the breast milk is called colostrum. It is like thick yellowish fluid, sometimes yellowish, but sometimes it can be white or some other color also. Like I think it's orange, not like greenish. It's not greenish means it indicates pus. So usually it is yellowish or whitish orange like that. So initially 3-4 days you'll be getting the colostrum milk. This is very thick. So very thick, though it is very small quantities, it is very important for the baby, because it prevents infections. It is very rich in antibodies and all the anti-infective factors. So this colostrum should not be discarded. So this is again a very bad practice which is followed in many by many people. Like they think that the first milk which comes from the mother is not good. They will be discarding it, and later they will start the feeding. That is a very bad habit, because the colostrum is very rich in antibodies and all the anti-infective factors which can protect the child from diseases. Next is the transitional milk. So after 3 to 4 days, this will be coming. So this is like a mix of colostrum and mature milk. Till 2 weeks it will be produced, and next is the mature milk. So this will be again containing all the protein, fat, all the requirement which is like composition which we have seen before. It's a mature milk. This comes after 2 weeks after birth of the baby. So the initial days, the first 2 weeks, the breast milk is very important for the growth of the and protection of the baby. So another milk is preterm milk. So some babies will be born before, due to any some kind of reason. So they may be born at 7th month. Some babies will be born at 8th month. So they are preterm. So it is not that they cannot take the milk. So that milk will be containing much more anti-infective factors, and all the protein, fat, and everything will be much more, because we usually think that as the mother has delivered before her due date or whatever, the breast milk may not come, but it's not like the delivery process itself. The hormones present in the mother will make her to produce the preterm milk. This is much more very energy rich and very nutritious for the growth of the preterm baby. So the term baby and preterm baby, the milk is very different. So according to the needs of term preterm baby, the milk would be varying. Okay. So in the mature milk, like what we have talked, first we will be getting the fore milk, like whenever the mother starts feeding. So first initially the breast milk would be watery, like most of the content is water, because it will be it will be satisfying the baby's thirst. Okay, it will be containing less fat and calories. And next one is hind milk. Like during, I'm telling you, one time when when the mother is feeding the baby, the first initial feed which she is giving will be fore milk, which is watery, and it will be quenching the baby's thirst. And next is the hind milk. This is little thick and rich in all the fats, calories, proteins, and everything, all the whatever composition which we are talking about. So both fore milk and hind milk are important. The mother should feed the baby till the baby is satisfied. Like satisfied means the baby will be calm. It will stop feeding, and the baby can sleep continuously for 2 to 3 hours. So that means the baby is satisfied with the breast milk. Okay, so you can estimate like whether the like some people may be asking, I'm giving feed, but I'm not understanding whether my milk is sufficient or not for the baby. So that we can assess by if the child is passing 6 to 8 times of clear urine and the child is gaining weight after 10 to 14 days of birth. That is, the child is crossing the birth weight. For suppose the child is born with 3 kgs and after 14 days, if it is 3.2 kgs, it indicates that okay, the breast milk is sufficient for the baby. So if the child is passing 6 to 8 times of clear urine and uh, baby is gaining weight after 10 to 14 days of birth, it indicates that the breast milk is sufficient for the baby. So crying is different because babies will be crying for so many reasons. So it doesn't mean that breast milk, of course, this is also one of the reason, because of if they are not having proper uh, insufficient feed, that time also they will be crying. So you have to assure the mother regarding that. So advantages of this breastfeeding, like what advantage do we have? There are so many advantages. It is safe, clean, hygienic, cheap, and available to the infant at correct temperature. You need not prepare anything. You need not go and buy from a retail shop. You do not know, like if the mother is taking sufficient food, that itself it is hygienic. The mother itself is producing from her own body, so it is sterile and it fully meets the nutritional requirements of the infant in the first few months life. Yes, compared to artificial feeds, this breast milk is very high. Even if you see in the bottles, if you buy, they will be writing as a note or disclaimer, mother's milk is best till 6 months of age. So if it is not possible, the mother is not able to feed only, you can go for artificial feeds. Okay, so breast milk is sufficient to reach the all whatever the requirement, the recommended dietary allowance of the child. It is sufficient during the first few months, the early 6 months. Everything the baby can entirely depend upon the breast milk for its requirement, its nutritional requirement. And this breast milk contains the antimicrobial factors like I told you, like there are so many like this secretory IgA, IgG, IgM, and lactoferrin, lysozyme, all the fatty acids and all the secretory enzymes which provides protection against this diarrheal diseases. Like those children who are breast milk have less chances of having diarrheas and necrotizing enterocolitis. Okay, and also the respiratory diseases also in the first few months of life. So this also provides protection against diseases, and this is easily digested. Like uh, the baby can easily digest, the digestive system can easily accept to this breast milk, and both the normal as well as the premature babies, those low birth weight or premature babies, they can easily digest without having any problem. And definitely the bonding, as the mother feeds the baby, the bond between the mother and infant is promoted. Okay, continuing, sucking, as the baby sucks the milk from the mother, it helps in the development of jaws and teeth. So it will be like an exercise for its mouth, so that will help in the development of jaws and teeth. And breastfed babies, they usually have uh, they they it protects from tendency to obesity, so they are having very less chances of becoming obese. And also definitely prevents malnutrition and reduces infant mortality because it meets all the nutritional requirements of the baby. And also the breast milk has good electrolyte, all the electrolytes are self-sufficient in it. So it prevents the neonatal hypocalcemia, hypomagnesemia. So any kind of electrolyte disturbances are also very less if the baby is consuming the breast milk. And also not only advantages to the baby, this breast milk also, this breast, due to this breastfeeding, it also provides advantage to the parents because it helps in spacing the pregnant, like next child birth, because the prolactin hormone which is present in the mother, this only produces because of breastfeeding. So this prolactin hormone suppresses ovulation and delays menstruation. So because of that, the mother can stay infertile for long time. Like if she's completely breastfeeding only, you can have, because this is not like it causes lactational amenorrhea. Think you know about this term. So this lactational amenorrhea, because of this, the mother has less chances of conceiving again. But it is always good to space the pregnancies by using some other contraceptive measures. But this also serves as one of the very important method in spacing the pregnancy. And for the child, the special fatty acids in breast milk leads to increased intelligent quotient and better visual activity. The breast milk contains so many uh, polyunsaturated fatty acids like DHA, docosahexaenoic acid, DHEA. So these are like helping the growth of the baby's brain. So in that way they'll be having good IQ. They'll be more intelligent compared to the non-breastfed babies. So this is about the advantages of breastfeeding. And also another 5 minutes we'll stop with breastfeeding. I will not talk about the complementary feeds today. We can talk in the next class. So coming to the proper positioning of breastfeeding. So the mother has to be like, giving breastfeeding is not like uh, just like any other normal activity. It has to be done in a proper way. In that process only we can assure that the baby is feeding well. Okay, to ensure the correct feeding method, there are some signs of proper positioning. First of all, the mother has to be she has to properly seated, and her back should be supported, because she has to be uh, being in that position for some period of time. So her back should be supported, and the baby should be turned towards the mother's side. So if you see in this picture, the baby is turned towards the mother's side. Her face, the baby's face is turning towards the mother's breast. And if you see, the baby is in a line, like the baby's head, neck and body are in a line, like there should not be any inclination. And the baby's body should be supported. You cannot just leave the baby. You can only touch the baby's head and leave the body. No, the whole baby should be supported with the mother's hand. See here, like this. So here the hand should be completely supporting the baby's body, and the head, neck and body should be in line. Okay. So the mother should be seated, the baby should be turned towards the mother's side. Baby's abdomen should be touching the mother's abdomen. So this is the cradle position, it's called. So this are the signs of good positioning of breastfeeding. And another one very important is good attachment. Signs of this is a very frequently asked question in Viva. What are the signs of good attachment of breastfeeding? So when the baby is sucking milk from the mother's breast, so it has to be attached, the mouth should be attached correctly to the nipple, because then only the baby can suckle the milk from the mother, otherwise it's not possible. Okay, so if you see this is a good attachment picture, and this is a poor attachment picture. So here if you see, the baby's mouth is widely open. So here it is not properly open. Here baby's mouth is widely opened, and the areola is almost covered. So here most of the areola is visible, but here almost the areola of the mother's breast is completely inside the baby's mouth, and the lower lip is everted. It's turned outside. Here the baby's lip is not turned outside, and the chin of the baby is touching the mother's breast. Here chin is not touching. So these are the signs of good attachment. Baby's mouth is widely open, lower lip is everted, the baby's chin is touching the mother's breast, and most of the areolae is not visible. So these are the 4 signs of good attachment of breastfeeding. Okay. So we'll talk about the baby friendly hospital initiative in the next class, because time is up. Um, please go through this in your park textbook. These are very, very, very important topics uh, which you have to know as a doctor, and also it's as it's a minimum basic things which you have to know for telling anybody or for your own knowledge. This at any whatever branch you take, this mother and child this related uh, subject you have to know very correctly. Okay, we will talk about this baby friendly hospital initiative. We will talk in the next class. Okay.